Hello, I'm Dr. Brandt Gibson, and I've been working with peripheral neuropathy for about 20 years. And there are some types of peripheral neuropathy that are more difficult to diagnose. One of these is porphyric neuropathy. Hepatic porphyrias is a group of rare metabolic disorders that are caused by a defect, an enzyme defect in the body where it has a problem metabolizing heme. And a lot of times in this case, if you have porphyrias, you're going to actually get a different types of symptoms, including peripheral neuropathy. So typically, you're with an acute attack, you're going to have an abdominal pain, you're going to have psychosis, and you're going to have neuropathy. But the neuropathy is often misdiagnosed. When you evaluate the cerebral spinal fluid and you look at the signs and symptoms of this type of neuropathy, most of the time it's misdiagnosed as an acute Guillain-Barré syndrome, and so it's not treated correctly. But the truth is, with porphyria or porphyria neuropathy or porphyric neuropathy, you're going to have a couple things that help you understand what's going on. Number one, you're going to have, of course, the peripheral neuropathy. You're going to have an underlying abnormality in the way the nerves are functioning. You're also going to have some abnormal asymmetric weakness. So you're actually going to have close to the trunk, proximal areas, you're going to have some asymmetric weakness, which means you're going to have weakness on one side, one leg or one arm, and not both sides. You're going to have electrodiagnostic testing that is indicative of axon injury or a neuropathy coming from the axon area of the nerve. And you're going to also have some psychological features. So you may not have a true psychosis, but you're going to have some psychological features that are associated with this type of peripheral neuropathy. So if you have a peripheral neuropathy and you're not exactly sure what it is, especially if you have family members that have it, because it's usually inherited in an autosomal dominant fashion. So if you have similar neuropathy symptoms to another individual and they've ever diagnosed you, say, with a Guillain-Barré or someone in your family with Guillain-Barré, you actually may have porphyrias or porphyric neuropathy, especially, like we said, if you have the abdominal pain, if you have proximal weakness, so weakness close to the trunk of the body, and any psychological type features. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget Day, what is it, 298. Thank you, and have a great rest of your night.